Someone in my network is refusing to return to work, citing mental health and anxiety. How can I help them?
This is actually quite common and certainly has been exacerbated in recent times. And I think it's a really difficult conversation and situation to navigate, because you want to be respectful of whatever mental health issues are at play, but also need to acknowledge that that's impacting, the team, the workplace. And so we do a lot of work with managers and leaders in recognising mental health issues and how to have the conversation in a safe, psychologically safe and respectful way. Of course, there's always referring the employees to, EAP programs and supports and avenues for them. And I think on a personal level, the individuals either take that up and benefit from it or they don't. But as managers, how we work with them on that is really tricky. And I think, there's some key things to have those conversations and to provide that safe space, to allow that level of vulnerability to occur, to send the message that, mental health issues are how they're going to impact them in the work, how they're going to impact them returning to work, how it can be explored and mutually worked on together. But it really is a tricky road to navigate. There's legalities around it. There's culture elements around it. There's policies and procedures around it too. But I think opening the door to the conversation is the first thing to do, and showing that you're willing to listen and you're willing to understand the mental health issues and how to work alongside them. Sometimes workplaces or managers can put together safety plans or keywords, or just something that allows the employee to feel safe to speak up and not necessarily open up, the whole story, but just to signal or flag that they're not traveling well, they're not coping, and have some support mechanisms in place when those situations arise or happen. And I think really understanding and navigating how those mental health and anxiety issues relate to that particular person, because someone with anxiety, for example, is not the same as somebody else with anxiety. And to what degree does their anxiety impact them? What are their triggers, and how to sort of buffer against those? I could talk about this for hours, but I know that we've got limited opportunity. Kimberlee, is that something that I saw you nodding there?
Yeah, so we have a keyword. Our keyword is surfs up. So we have whenever anyone identifies with sort of having a mental health episode or suffering some form of anxiety, just as a result of the waves that come and go, with these sorts of conditions. Surfs up is the word. So staff will come to us, they will let us know what's going on, and the plan that we have in place is, surfs up. If I get a text message that says surfs up, I know exactly what's going on, and the one requirement we have for those staff members is that they will take a phone call from me at the end of the day, and that's just to check in to make sure that they're doing okay and they've got people around them. I think, but Amanda, you asked, it is such a fine line for business in relation to mental health, and we certainly have had some incidents of it recently. We've had some young people who were really struggling to self-isolate themselves, had moved down to Victoria to take a role in the big smoke out of country Victoria, and were living alone, and then ended up in lockdown, and so also didn't have friendship circles, didn't have family circles, were really, really isolated. And so we would reach out and find opportunities for connection, but ultimately it is up to them as to whether or not they want to take it. But what we had to avoid was getting into conversations specifically in relation to their conditions, because we're not psychologists, we're not trained to be able to give advice in that area. We have an EAP program in place as well, so we would always reference to there. And importantly, that program exists not only for the employee, but also the employee's family members, so encouraging them to perhaps get other people to reach out on their behalf if they don't feel that they can. And we also went through a process of not normalising not normalizing mental health, but normalizing the way that many of us were thinking and feeling over the course of the last couple of years. So we did bring organizational psychologists in to just talk about some of the trends, some of the observations that were happening, and, you know, just make sure people feel supported.
Yeah, I think, you know, there's a limit as to what you can do, and workplaces are doing a lot more than they were before. You know, and there's a lot of research and literature and royal commissions out there, and mental health reform and all of that going on, and workplaces are more attuned now than ever before to mental health issues and how they play out for people and in the workplace. But there's a point at which workplaces can't do more, and then it's up to the individual person. But I can't express how valuable having something simple like a code word makes a much more inviting and vulnerable space seem safer.
Yeah, great. We have a Slack channel at our work called Heads Up, and as soon as people post into it, it's actually it's not just a release for you; it's like a release for everybody else, because suddenly they go, "Oh, I've been feeling the same way." It's almost like that wave of thank you for bringing it up. It really does help with that kind of vulnerability. That's
a good point to raise, because sometimes we feel anxious, but we don't have a diagnosed anxiety disorder, and it's still okay to feel anxious. And, you know, we all have waves, whether we're diagnosed or not. Labels sometimes don't mean much.